Hey y'all, welcome back to my channel, Journey to Happiness. And if you're new here, welcome to my channel. I would love for you to like, comment, subscribe, and hit the notification bell. That way you'll be notified every time I upload a new video. So today's video, I have 7 tips for new med aids. Now this is going to be for new med aids, not necessarily med techs. I'm a med tech as well as a med aid, but I mainly work as a med aid. And there is a difference between med aid and med tech as far as like where you can work it and stuff. Even though they both pass out medicine, that's like a big part of the job, is passing out medicine, whether you're a med aid or a med tech. But it is a difference in job responsibilities to, like. But anyway, if y'all want to make a video about tips for med techs, then I'll do that. But this is for med aids. So, and make sure you watch the whole video, because the 7th tip is going to be the most important one. They're all important, but I feel like the 7th tip is the most important one. Oh my god. I don't know why I'm just coughing out of nowhere. What in the world? Excuse me, y'all. This is not going to be an edited video, so y'all going to see that. And if y'all see dog hair, I just dropped my grandma's dog off for him to get a bath and get his nails cut and stuff. And he sheds really bad, so that's why you may see dog hair on my shirt. Okay, to the video. So the number 1 tip I have, or the first tip I have, is to stock your cart at the end of your shift. So it's important to stock your cart at the end of your shift, because it's just common courtesy to the nurse or the med aid that's going to be coming behind you. Don't leave your cart in a mess and stuff. Stock it with cups, you know, the little cups that you put the water in, the little medication cups, spoons. If it's running low on gloves, get some more gloves. Tissue. The reason you need tissue is for the residents that get eye drops. And in long-term care facilities, I notice a lot of residents get eye drops. You want to give them a tissue when you're done putting their eye drops in their eyes, so they, you know, pat their eye. What else? Yeah, any little supplies. Oh, straws. Make sure the water pitcher is filled up with ice and water, filled up. Empty the little trash can that's on the side of the med cart. Empty that and wipe it down. Wipe the med cart down with a bleach wipe, or, you know, some kind of sanitary wipe. Make sure everything is nice and clean, you know, because it's just common courtesy. Just like when you're a CNA and you're doing your last round, you make sure everybody is okay, in good shape for the next shift, for when they first get there. It's the same thing. It's just, you know, you don't want to be known as the nurse or the med aid that leaves the cart in a mess. Now, I understand sometimes, you know, especially on first shift, something may happen where it may get really busy and you just didn't have time. You know, 3 o'clock comes around so fast, or, you know, if you get off at 7. So you don't have to leave the cart perfect every single time. If, you know, something came up that you didn't have time, but at least empty the trash. At least empty the trash and stuff like that. Think about, you know, when you first get to work, how you would want the cart to look when you just got there. Stock it like you would want, the way that you would want to come in, you know. So yeah, that's tip number 1. So tip number 2 is ask your nurse. What I mean by that is, if you're ever unsure of anything, as a med aid, there's always going to be a nurse over you in the building. Ask the nurse. That's what they're there for. That's why they getting paid more than you. That's why they went through nursing school, to answer the questions. They're supposed to just, oh my eye, hold on y'all. Okay. They're supposed to know more than you do, more than you know. That's why they're a nurse, you know. That's why they're getting paid more. That's why they're over you. So that's what they're there for. You don't want to, you know, make a mistake that could have been avoided if you would have just asked the nurse. You know, if you're unsure of a medication, or, you know, if you have any concerns, like this patient's acting weird, they're not acting like their regular selves, should I still give them their oxycodone, their sleeping pill, or anything that you're ever unsure, ask the nurse. So number 3, I put always count off your narcotics. So what that means is, when you come on to your shift, whoever the med aid is before you, or the nurse, you and that person is supposed to count off their narcotics to make sure everything's there, everything matches up in the book, and everything's right. Because with narcotics, you know, people get addicted to that. People steal narcotics. Actually, I think I've witnessed twice when I'm working as a med aid that a nurse got caught stealing some narcotics. Actually, the cops were called. This was a long time ago, and she was new to the facility. And I think I told y'all about this in a different video. So she got fired and actually got arrested. And now she's got a job as a waitress at her. She works with her mom at this restaurant. So luckily, she found another job, but she will never be able to work as a nurse again, I'm sure. And just to think, but anyway, so always count off the narcotics, because once you accept those keys and you accept that cart, you are responsible for that medication on that cart. So if a narcotic is missing, and at nursing homes, they take narcotics very, very seriously, because I guess people get addicted to them, and people are known to steal for narcotics. So if something gets missing or if something happens with the narcotic, they're gonna be looking at you. You're the first person they're gonna be looking at, because you accepted those keys. When you accept the keys, that's saying, okay, I agree. This narcotic box is right. Everything is there. We counted off. I agree. That's what you're saying when you accept those keys. But anyways, always count your narcotics, because some people, if they've been working with a certain med aid or a nurse for a long time, where they know them, they trust them, sometimes, like, if they're running late or whatever, but we ain't got to count. I know you're a good nurse, or you're a good med aid. We ain't got to count. Don't do that. Don't mess yourself up like that, because you just never know. Because who would think, why would a nurse, somebody that went through nursing school, why would you steal narcotics off a cart? Why would you risk your career for that? Why? You wouldn't think that, right? But I've seen it happen. So you just never know. So don't trust nobody. Count them narcotics. Okay. So I got number 4. Number 4 I got is sign off the narcotics as you give them. Meaning, let's say I'm about to give somebody a Percocet, right? So I pop the Percocet out, make sure you got the right patient and stuff. And they have a book that you're supposed to sign off every time you give somebody a narcotic. Some nurses and med aids, they wait till the end of their shift or the end of their med pass, and they sign it off like then. I don't know why. To me that's kind of crazy. But let's say, like, every time you give somebody a narcotic, you pop the narcotic, make sure you got the right narcotic, the right patient, and go ahead and sign it in the book. Find their name and sign it then and there. Do not wait. I recommend anyway, don't wait till the end of your shift to try to go back and look and sign off narcotics, because your count, it's just don't do that. It's just, to me, that makes the job harder, because you got to remember everybody that you gave a narcotic to. And then it's like, I know some med aids that don't sign as they go. Then when we're counting on shift change, the med aid, the narcotics aren't matching up, and they're like, oh, I forgot to sign this, and that's not a good look. That's not a good look. So sign stuff off as you give it. Trust me. That's what I would recommend anyway. So I got number 5, and it says, don't try to be a nurse. And what I mean by that is, sometimes when people become med aids, they kind of like get a big head, and that's a good thing that you're a med aid. Congratulations. That's an accomplishment to have that med aid certification under your name, But don't try to be a nurse. You're a med aid, not a nurse. You didn't go through nursing school like a nurse did. So stay in your place. If there's something going on with a patient, like, oh, I had this rash on my bottom, or can I ask you about this? And that it's something that you really shouldn't be answering as a med aid. Even if you think you know the answer, go refer them to the nurse. Be like, okay, well, let me ask the nurse about that. Well, you know what I'm saying? Don't try to be a nurse when you're not a nurse, because in the end, something's going to come up and that you really can't answer. And you're going to, at that point, you're going to have to say, let me go get the nurse. So let me ask the nurse. And the patient was going to be like, oh, I thought you were the nurse, Because, don't try to be a nurse. Be a med aid. You're not getting paid like no nurse. So don't try to act like you're a nurse. You know what I'm saying? You're not paid to know everything or to know what the nurse knows. So don't get a big head. Don't get ahead of yourself. If you want to be a nurse, go back to nursing school, but just be a med aid. Don't try to answer stuff that you shouldn't be answering, because even if you think you have the right answer, you don't want to tell a patient the wrong thing. There's certain things that nurses know that med aids don't know because they went through nursing school. That's why they're getting paid more, right? So just stay in your place as a med aid. Don't try to play supervisor to the CNAs. You could communicate to the CNAs if you need to communicate something to them, but just don't try to be a supervisor. Don't try to be the head like you're a director of nursing. You're a med aid. You know what I'm saying? Like, I've seen where med aids almost got fired because they answering patient asks them about something that they know they should have told the nurse about, and they want this big roles as a nurse, but when they're not one, and then they end up telling the patient the wrong thing, and then it was this whole big thing. So stay in your place as a med aid, until you go back to nursing school and become a nurse. And there might be something. Now I'm speaking of stuff that you should let the nurse know. There might be some things like, okay, let's say a patient tells you they have a headache, right? They have a headache. So it's common knowledge, you can give a Tylenol to try to treat a headache, right? So you go in the MAR and you see they have it is PRN, go ahead and give them the Tylenol. You know what I'm saying? But don't try to diagnose patients. Don't try to change their medication. Like I saw one time where a med aid, this patient was complaining of a bad headache, and she was like, they got the regular Tylenol, the 325, and they were like, can you give me something stronger, please? And can you believe that med aid gave them a 500 milligrams? That's the extra strength Tylenol, even though the patient didn't have an order for one. Now, it sounds simple, right? Like, what harm is that going to do to give the patient 500 milligrams of Tylenol versus just the 325? That is not your place as a med aid to make that decision. I don't care how small or how big it is. You cannot you're not supposed to give, even the nurse isn't allowed to give a medication that is not ordered to the patient. The doctor is the one that places the orders. You know what I'm saying? So just stay in your place as a med aid until you go through nursing school and become a nurse, and then that's when you could play your role as a nurse. But anyway, this video gonna be long, y'all. Okay, so number 6, I have get familiar with generic brands, medications, and different names of medications. What I mean by that is, there's so many medications that have 2 different names. Just like, let's say you have Frosted Flakes, right? Then you have the off-brand name. I forgot the off-brand name, the generic name. So you're looking in the MAR, you might see, I'm gonna give y'all some examples. I wrote them down. Hold on, y'all. Let me turn this car off. Alright, y'all. So like Zofran, for example. So let's say a patient says, can I have my Zofran? So you go to the MAR, you go to the patient's name, to look up if they have it PRN, and it might not say Zofran. I do not know how to pronounce this word, y'all. But my nurses that watch me, I'm sure y'all know what this is. It's pronounced, it's spelled O, is that an A or O? OANDASTERON. But anyway, it's the generic name for Zofran, or a different name for Zofran. It's the same exact medication, it's just another name. So I would, before you start your first day as a med aid, kind of get familiar with the generic names of medications. This is something that you'll learn over time, but I think to give yourself a good head start, that's a good idea. Just like Percocet. Another name for Percocet is oxycodone. Now, a lot of y'all might already know that. I didn't know that before I came to med aid because I don't take narcotics. I never took a narcotic in my life. So I don't know the different names of, pain pills and stuff. So, let's say a patient, they might ask you for their PRN and Percocet, right? So you go to their MAR to see if they can have it or not. And it might not say Percocet. it will probably say oxycodone. So you have to know that means the same. That's the same thing, you know. So another thing is, don't be scared to look stuff up. Go on Google, and you know, if you see like I'm sure y'all know about this Tylenol, right? That's the same name. I don't even know how to pronounce it, so I'm not gonna try. But it starts with an A, the off-brand name for Tylenol. So don't be scared to look up medication in the dictionary, or I use Google sometimes, because there's like so many different names for medications. So yeah, get familiar and just know that a lot of medications, they have the brand name and then they have the generic name. But in the MAR, it's most of the time it might have just one or the other. It's not going to have Percocet and / oxycodone. It might just have oxycodone, or it might just have Percocet, and you need to know when you see oxycodone and the patient is asking you for Percocet, that's the exact same thing. It's just 2 different names. So yeah, and this is my last and final tip for today, is make sure to try your best to prevent a med error. Is tip number 7. Follow the 6 rights. I think it's 6 now. Hold on, y'all. I think, let's see. 1, 2, 3. I got 5. 1, 2, 3, 4, 5 rights. It used to be 6. I don't know. They keep changing it. But make sure to prevent a med error. Make sure before you hand that medication to the patient, make sure you have the right patient, the right medication, the right time, the right route, and the right dose. So right patient, obviously, you look at the patient's room number. You look, they might have a band on them, or if you're working at a facility where you're already a CNA and you just got promoted to med aid, you probably know most of the patients anyway. But make sure you got the right patient. Some places, they have pictures of the patients in the MAR, so you can see what they look like and you're matching it up. One thing I do if I'm working with patients that I've never worked with before, I say, can you tell me your name, please? And if they are able to, they can tell me their name. And I see, oh, this is supposed to go to Miss Smith, and she just told me her name is She told me her name is Patty Smith, and her name is Patty Smith in the computer. So that's another way. So make sure you got the right patient. The right medication. So many medications have similar names, like they're spelled very similar, some of them. So just, you know, double check, make sure you have the right medication for that time. The right time. When you're reading the MAR, make sure you're doing the right time. Because sometimes, you know, you might be going fast and you trying to hurry up, and you see, oh wait, this says she gets this at 9 o'clock, and you doing your evening med pass. So just make sure you skimming through, make sure it's the right time. Oh, and you probably, if you're a med aid, you notice, you could do an hour before and an hour after. So let's say somebody's medicine is due at 5 o'clock. You have an hour window, so you can technically give their medicine as early as 4 o'clock or as late as 6 o'clock, and it's still on time. The right route, you know, whether it's tropical or, you know, they're supposed to have it oral or whatever, just, you know, make sure that's, and the right dose. Make sure you're giving them how much you're supposed to give them, whether it's 0.5, 30 milligrams or whatever. Just double check. And yeah, because the main thing is do your best to not make a med error. No, nobody's perfect. If you make a med error, it's not going to be the end of the world, depending on what the med error is. But to try to do your best to prevent from making a med error, follow those 5 routes. And I don't think you'll make a med error as long as you do that. And don't feel bad if you're kind of slow at first. I was slow at first. I've been looking at the nurses and the other medics, like, dang, they open that cart, they popping them pills all, like it ain't nothing. But take your time, because it's more important to make sure you're giving them the right medicine. You're giving the right medicine to the right patient, the 5 rights, you know. Then you be done super fast. And the more you do it, the faster you're going to get. Anytime you're doing something that you ain't never done before, you're going to be slow with it. Most people, you're going to be slow with it. You know, especially something important like giving people medicine. So don't beat yourself up if it takes you more time versus the med aid that's been doing it for 2 years or the nurse that's been doing it for 5 years. You know, take your time, follow the protocol, and you should be fine. I did not mean for this video to be 20 minutes, so I'm going to go ahead and head out now, y'all. If you have any other questions, definitely comment below, and I'll answer them. Don't forget to like, comment, subscribe, and I'll see y'all the next time.